In the last centuries, with the increasing of life stresses and requirements, which has also dramatic effect on people's lifestyle, a lot of health problems appeared without any significant causes or specific reasons. Chronic body pain in young ages, fatigue, decreased physical activity, gastrointestinal disorders, increase the risk of heart diseases and cancers. These complaints or comments are heard in many medical specialties: orthopedic, internal medicine, gynecology, pediatric, without knowing the clear reason behind these complaints. But after laboratory investigations, it was found that the deficiency of important element can be the reason for all these health problems. And with the effective treatment and the right dose, with a change in the lifestyle and increase the physical activity, all these symptoms mentioned will have a great improvement. This important element, which plays a role in most of vital cellular activity in the human body, is vitamin D.
Yes, vitamin D. The hottest topic in medicine these days is not newest drug or latest surgical device, but guess what? It is a vitamin D. But behind vitamin D, it is a long story about its discovery. So in the next video, we will see a summary about the history of vitamin D. Let's see the video. Over 3,000 years ago, in the ancient Egyptian civilization, it was believed that the sun is the source of health and light. Also in the Greek civilization, there was a connection between the sunlight and healthy bodies. The discovery of vitamin D started in 1914 by American researchers Elmer McCollum and Margaret Davis, when they discovered a substance in cod liver oil, later called vitamin A. Then noticed Dr. Edward Millenby that dogs that were fed cod liver oil didn't develop rickets, concluded vitamin A or associated factor. 1922, McCollum tested modified cod liver oil in which vitamin A has been destroyed. The sick dogs cured. So he concluded the associated factor in cod liver oil, which cured rickets, was distinct from vitamin A, and he named it vitamin D because it was the fourth vitamin. In 1923, American biochemist Harry Steenbach at University of Wisconsin demonstrated that irradiation by ultraviolet light increased the vitamin D content of foods and other organic materials. In 1925, it was established that when 7-dehydrocholesterol is irradiated with the light, a form of fat-soluble vitamin is produced, now known as vitamin D3. Alfred Fabian Hess stated, light equals vitamin D. In 1932, Otto Rosenheim and Harold King published a paper putting forward structures for sterol and bile acids, which found immediate acceptance. The informal academic collaboration between the team members Robert Benedict, Otto Rosenheim, Harold King, and Kenny Scullo was very productive and led to the isolation of vitamin D. In 1969, after studying nuclear fragments of intestinal cells, a specific binding protein for vitamin D called vitamin D receptor was identified. by Mark Hausler and Tony Norman. Later, the vitamin D metabolites, calcifidiol and calcitriol, were identified by competing teams led by Michael Hollick in the laboratory of Hector De Loca and by Tony Norman and colleagues. So we know now about the history of vitamin D, but now we have to know about the types of vitamin D. There's two major types of vitamin D: the ergocalciferol, D2, and the cholecalciferol, the D3. So, the sources of the vitamin D, it is a variable. The main source of vitamin D is exposure to the sunlight, ultraviolet rays. And there is also dietary sources of vitamin D. There is several vitamin D rich foods like cod liver oil, eggs, raw milk, mackerel, tuna fish, salmon, sardine, caviar. All of these natural foods, they have a high content of vitamin D. So now let's talk about the sciences and transformations of vitamin D. But at first we have to know that the skin, there is a two major layer. The deep layer, which is the dermis, and there's a superficial layer, which is the epidermis. In the deep layer of epidermis, there is a type of cells which develop or synthesize the vitamin D, named keratinocytes. So whatever the vitamin D formed from the skin through the irradiations or exposure to the sunlight or taken from the food, the vitamin D, ergocalciferol or cholecalciferol, will be transported to the liver. And in the liver will be the first hydroxylation of the vitamin D in position 25 to be 25 hydroxy cholecalciferol. Then it will be released in the bloodstream through a specific protein named vitamin D binding protein, and this will be transported to the kidney, where the second hydroxylation will be done, but in the position 1 alpha. At the end, the result is formations of the active form of vitamin D, which is 1,25 dihydroxycholecalciferol. This is the active form of vitamin D. So this active form will be released again to the blood and spread all over the body to hit specific target organs like the intestine, like bone, like parathyroid gland, and also the kidney, which will regulate the level of calcium and phosphate. There is also another target organs which contain also vitamin D specific receptors. It is found in the skin, musculoskeletal and muscles, found in the pancreas, also found in the thyroid or a parathyroid gland, and this also in turn affecting many vital functions in the body. As we know now that the vitamin D is already integrated in most of body organs and systems. So what about the deficiency? If there is any common symptoms of deficiency, how we know that we have a vitamin D deficiency, or at least suspect of vitamin D deficiency? The most common symptoms of vitamin D deficiency is fatigue, muscle pain, muscle weakness, generalized body ache, bone pain. Also, there is a correlation between low level of vitamin D and high incidence of cancer, especially cancer colon. Also, many studies showed that there is a correlation between vitamin D or low vitamin D and diabetes mellitus. High incidence of cardiovascular diseases in low vitamin D levels. And also we have to know the high risk of death or increase the mortality in elderly by low vitamin D, which is most common in this age. Also, there is a great link between low vitamin D and autoimmune diseases like asthma. Now we know the importance of the vitamin D, and we know that the vitamin D deficiency, it is a major problem. So who suffers from vitamin D deficiency? Vitamin D deficiency, it is a worldwide disorder in most of the world, but high in China, Latin America, Mongolia, Africa, and also in the Middle East. In the latest literature, it shows that the United Arab Emirates, it is the most country with a high level of vitamin D deficiency. There is many factors responsible for this high level of vitamin D deficiency: environmental, cultural, social factors. All of this cause no direct exposure to the light, and this will enhance the deficiency of vitamin D in our bodies. You can check this link showed now about this publication, which shows, as I told you, that the United Arab Emirates has the highest level of vitamin D deficiency. So now we know the importance of the vitamin D. Now we have to know the normal level of vitamin D. In the lab investigations, we can say below 30 nanogram per milliliter, it is a case of vitamin D deficiency. But we have always to keep the vitamin D level above the 30 nanogram per milliliter. This means in the best condition to have the best outcome, at least it must be above 40 nanogram per milliliter. Now we know the normal level of vitamin D, and we know the importance of the vitamin D. But the question is, what is the causes of vitamin D deficiency? There is a lot of risk factors which cause a vitamin D deficiency. The first one is no sunlight or no exposure to the sunlight. Second thing, decrease the absorptions of vitamin D, like malabsorption, syndromes like celiac diseases or Crohn's disease, or malnutrition. Decrease in the food-rich vitamin D. Also, there is one thing play an important role in the vitamin D deficiency, which is obesity. One of the also risk factor is the dark skin pigmentation, because the dark skin people, the melanin pigment worked as a sun protector, and this also decreases the absorption or formations of the vitamin D through exposure to the light. So we know now the importance of the vitamin D and also the risk of vitamin D deficiency. The question is now how we can treat it. In the slices I will show now, there is a table showing the recommended doses of vitamin D in different age groups, starting from 0 till the elderly patient. But in the practical way, or a practical basis, we treat our patients like following. By acute deficiency of vitamin D, we give a high dose of vitamin D in two forms. Either the injection form, which contain 300,000 international units in single injection, or 2 injections in 6 weeks interval, or oral form, which contain about 50,000 international unit, can be given once weekly and for about 12 weeks. And then we have to control the level of the vitamin D, either to stop the high dose of vitamin D or to continue the vitamin D high dose intake. The question is now, what after treating vitamin D? The vitamin D deficiency, as I told you before, there is a lot of risk factors. These risk factors must be at first treated. We have to change our life. We have to increase the physical activity. We have to increase exposing to the sun just to maintain the vitamin D in a normal level and avoid any deficiency in vitamin D. At the end, all over the world, there is a lot of vitamin D supplements in different doses. Some companies offer 400 international units, others 1,000, others 2,000. But all what I can say is just choose the right dose for the right patient. At the end, I hope that you enjoyed our video talking about the vitamin D and the importance of the vitamin D, and we see you in the next interesting video. Thank you very much.